Here we have a sagittal section of the male pelvis. You can see over here we have the sagittal view of the penis, the testis, the scrotum, the pubic bone, the urinary bladder. Here we have the prostate gland. Today we will be looking at the prostate gland. Now, the prostate gland, this is a male accessory sex organ which is present behind the pubic bone and surrounds the neck of the bladder in the males. The prostate gland, it is a conical fibromuscular glandular organ, and majority of the bulk in the semen is constituted by the secretions from the prostate. The secretions from the prostate, they are slightly acidic, consisting of acetic phosphatase, consisting of fibrinolysin and large amounts of zinc along with prostaglandins. The prostate gland consists of an apex which is directed downwards and a base which is present right around the urinary bladder, the neck of the urinary bladder. So we have an apex which is present just above the perineal membrane or the urogenital diaphragm, the base which is present at the neck of the urinary bladder. A part of the base from the posterior end is going to be present in the area of the urinary bladder, forming the uvula vesicae. Okay. We have an anterior surface. The anterior surface of the prostate gland is convex and is present beneath the lower part of the pubic symphysis, separated by the retropubic fat, which consists of prostatic venous plexuses, the retropubic area. The posterior surface is flat and is separated from the rectum by a fascia known as the fascia of Denonvillers. Okay, over here, if I show you over here, I have the urinary bladder and this is the prostate gland. So the prostate gland consisting of an anterior surface, consisting of an apex, consisting of a base and the posterior surface. Now the posterior surface is flat, as you can see, is divided by a transverse ridge into an upper smaller part and a lower larger part. The upper smaller part will be known as the median lobe. In the lower larger part, we are going to have a median sulcus, which is going to divide the lower posterior part into two lateral lobes. So anatomically, we have three lobes, that is the median lobe present above the transverse ridge and two lateral lobes. The transverse ridge, at both the ends of the transverse ridge, we are going to have the ejaculatory ducts. How is the ejaculatory duct formed? The ejaculatory duct is formed by the vas deferens and the seminal vesicles. The duct of both these structures are going to fuse and form the ejaculatory duct, which is going to be present at the distal part, or which is going to be present at the ends of the transverse ridge. The prostate gland consists of the anterior surface, the posterior surface and two infrolateral surfaces. This is the apex and this is the base. Anatomically, we have three different lobes, which is basically present on the posterior surface, divided by the transverse ridge and the median sulcus into an upper median lobe and the two lateral lobes. Now here, what I want to show you is the structures piercing the prostate gland. Now here I have given a cut section from the anterior surface, and if you can see the inner of the prostate gland, these are the structures piercing the prostate gland. This is the prostatic urethra, which consists of this fold-like structure. You can see the fold. This fold is known as the urethral crest. This fold. This is known as the urethral crest. Okay. In the center of the urethral crest, you can see an eminence. This eminence is known as viromontanum, also known as the seminal colliculus. In the center of the seminal colliculus, you can see the opening of a structure which is known as the prostatic utricle. This is the prostatic utricle. And on the sides of the prostatic utricle, we are going to have the opening of the ejaculatory ducts. Now this prostatic utricle, it is a cul-de-sac approximately 6 mm in size, and it goes upwards and backwards, and it is homologous to the vagina in the females. That is why it is also known as the male vagina or the vaginus masculinus. Okay, so this is basically the demonstration of the prostate gland, wherein the main focus was on the structures piercing the prostate gland. Again, we have the anterior surface, the posterior surface, the two lateral surfaces, the infrolateral surfaces,